Blood clots. The unexpected symptoms that could save your life. Hey everyone, welcome back to Vital Signs. Today, we're diving into a crucial health topic that could quite literally save lives. Blood clots. Blood clots are behind some of the most dangerous medical emergencies, including strokes and pulmonary embolisms. In the United States, blood clots affect around 900,000 people every year, with nearly 100,000 deaths as a result. Yet despite these staggering numbers, many people miss the subtle, early warning signs that could alert them to a potentially life-threatening clot. In this video, we'll go over the top warning signs that might mean a blood clot is forming somewhere in your body. Some of these signs you might never connect to blood clots. And if you stay tuned until the end, I'll share one particularly strange and unexpected symptom that could surprise you. Before we dive in, make sure to subscribe, give this video a thumbs up, and turn on notifications to keep up with all our vital health insights here on Vital Signs. We're committed to helping you stay informed and healthy, so let's jump into today's topic. So, here's the deal. Most people think they'd notice a blood clot if it happened to them. But clots can develop with symptoms so subtle or unexpected that they're easy to miss or mistake for something else entirely. Today, we'll go through these surprising signs of blood clots. But here's a twist. One symptom in particular might really surprise you and could be the key to spotting a clot early. So stick around because this symptom could make a big difference. Let's first talk about why having smooth, clot-free blood flow is so important. Imagine your blood vessels as a vast network of highways, delivering oxygen, nutrients, and immune cells to every part of your body. This highway system keeps everything running, carrying away waste products and supplying life-sustaining resources every second of every day. But when blood clots form, they're like sudden traffic jams that can block blood flow and cut off oxygen to vital organs. Clots are necessary to stop bleeding when we're injured, but sometimes clots form without any injury, and that's when problems start. Blood also plays an essential role in fighting off infections and healing wounds. But if clots form in places they shouldn't, they can block arteries and veins, cutting off circulation to critical organs like the heart, lungs, or brain. Now that we understand the importance of blood flow, let's dive into the symptoms that could signal a dangerous blood clot. Some of these might surprise you. Warning signs of blood clots. Now that we've covered why blood clots can be so dangerous, let's look at the top warning signs that could mean there's an issue with your blood flow. Symptom 1. Swelling in one limb. Swelling in a single limb, often just one leg, is a common sign of a blood clot in a deep vein, known as deep vein thrombosis, or DVT. This swelling happens because the clot blocks blood flow back to the heart, causing a buildup. The limb may also feel warm, appear red, or look visibly larger than the other leg. It's easy to mistake this for muscle strain or injury, but if one leg is swollen and there's no clear reason, get it checked out. Symptom 2. Persistent headaches. Next, let's talk about headaches. Persistent, severe headaches that don't respond to usual treatments can be a sign of something serious. Blood clots can form in the veins that drain blood from the brain, leading to a condition called cerebral venous sinus thrombosis, or CVSD. This can cause intense headaches, blurred vision, or confusion. If you have headaches that seem out of the ordinary or are paired with these other symptoms, it's worth consulting a doctor. Symptom 3. Shortness of breath and chest pain. Another major warning sign is shortness of breath paired with chest pain. A blood clot in the lungs, known as a pulmonary embolism, can cause these symptoms. Many people may mistake this for respiratory or heart problems, especially if they've recently been active or felt stressed. However, if you have sudden shortness of breath or a sharp stabbing pain when you breathe, it's essential to seek medical help right away. Pulmonary embolisms can be life-threatening if left untreated. Symptom 4. Skin color changes. Blood clots can also cause changes in skin color. If there's a clot in a limb, you might see the skin turn red, blue, or purple in the affected area. Sometimes it might feel warm, while in other cases, it could feel cool due to restricted blood flow. People often dismiss these color changes as bruising, but if you see this without a clear cause, it could mean blood isn't circulating properly. Symptom 5. Persistent cough or bloody sputum. A persistent cough, especially one that produces blood, is another symptom to watch for. When blood clots form in the lungs, they can cause irritation or small tears, leading to blood in the sputum. People often think this symptom is due to allergies or a respiratory infection, but if there's blood in your cough with no obvious cause, consult your healthcare provider. Symptom 6. Leg cramps or soreness that won't go away. Leg cramps or soreness, especially when persistent, can be another sign of a clot. Pain from a DVT doesn't improve with rest and may even worsen when standing or walking. People often mistake it for soreness from physical activity, but if the pain doesn't subside, especially in just one leg, it's worth a closer look. Don't forget, there's still one particularly unusual symptom coming up that might surprise you. This could be the clue you need to catch a blood clot early, so stay tuned. Symptom 7. Extreme fatigue. Feeling unusually tired without an obvious reason can also be a red flag. Fatigue can occur if a blood clot is blocking circulation, forcing your body to work harder to keep blood flowing. If you're consistently fatigued without a clear cause, and especially if it's combined with other symptoms, it's something to take seriously. Symptom 8. Dizziness or lightheadedness. Frequent dizziness or lightheadedness, particularly when combined with shortness of breath or vision changes, can be another warning sign. Blood clots in the lungs or brain can restrict blood flow and oxygen, leading to this sensation. If dizziness becomes frequent and unexplained, it's worth speaking to a healthcare provider. Symptom 9. Jaw pain or toothache. And now for that unusual symptom, jaw pain or even a toothache. Blood clots can sometimes cause referred pain, meaning the discomfort shows up in one area while the actual problem is elsewhere. Jaw pain is often mistaken for a dental issue, but if it's combined with other symptoms like chest pain or shortness of breath, it could be a sign of a vascular issue that needs attention. Now that we've covered these warning signs, you might be wondering how to reduce your risk of blood clots. Fortunately, there are several practical steps you can take to protect your blood vessels and keep your blood flowing smoothly. Let's dive into these proactive lifestyle tips. Tips for maintaining healthy blood flow. Here are some effective tips to help reduce your risk of blood clots and keep your blood vessels healthy. 1. Stay active. Regular movement promotes blood flow. Aim for activities like walking, stretching, or standing up regularly, especially if you sit for long periods. 2. Stay hydrated. Hydration is key. Drinking enough water helps keep your blood flowing smoothly and prevents it from becoming too thick, which can increase clotting risk. 3. Eat heart-healthy foods, including foods rich in antioxidants, like leafy greens, berries, and fatty fish, supports blood vessel health and reduces inflammation. 4. Avoid smoking. Smoking damages blood vessels, raising the risk of clots. If you're a smoker, quitting can greatly improve your vascular health. 5. Be mindful of certain medications. Hormone therapies and some other medications can raise clot risk. If you're on these medications, talk to your healthcare provider about managing the risks. 6. Monitor blood pressure and cholesterol. High blood pressure and cholesterol are significant risk factors. Regularly check these levels and follow your doctor's guidance to manage them. 7. Wear compression stockings. Compression stockings can help improve blood flow, especially if you're at higher risk, like when traveling long distances or recovering from surgery. 8. Practice good posture. Good posture helps circulation. Sitting straight and taking breaks to move around reduces the risk of blood clots forming. Today, we've covered some surprising symptoms and essential tips to prevent blood clots. The main takeaway is that recognizing these subtle signs early can genuinely be life-saving. By staying alert to unusual changes in your body, like persistent leg pain, unexplained fatigue, or sudden swelling, you can take action before a clot develops into a severe health issue. Incorporating small, proactive changes, like staying active, eating a heart-healthy diet, and keeping hydrated, can significantly improve your overall health and reduce your risk of clots. And don't forget, regular checkups are vital for monitoring your health and catching any potential concerns early on. Thank you for joining us on Vital Signs. If you found this video helpful, please give it a thumbs up, subscribe to our channel, and turn on notifications so you'll never miss out on essential health insights. And we'd love to hear from you. Have you or someone you know ever experienced any of these symptoms? Your experience could help someone else, so feel free to share it in the comments. Remember, taking care of your blood flow is taking care of your health. Be vigilant, stay proactive, and make choices that support your wellness. Take care, and we'll see you in the next video.